All right, good afternoon. Thanks for joining us today. Today we're going to be talking about whether can healthcare organizations with small provider networks benefit from an outsourced directory improvement solution. I'm Christopher Swartz. I'm the Provider Directory Data Improvement Manager here at CAQH, and I'm happy to welcome you to our midday download. So this is an abbreviated web series which we use to offer you a concentrated amount of information in 30 minutes or less. Now, this month is always fun for the provider data nerds here at CAQH because it's National Provider Directory Improvement Month. So if you're involved with provider directory data improvement, make sure to highlight the great work that you're doing on Twitter and LinkedIn. This is really our time to let the industry know all the great things that we're doing. And from the registration list, it looks like there's a number of organizations today that have a smaller provider network, really wanting to discuss methods for cleaning up those directories, which is great. So I hope you'll find the information we're discussing today very useful. So let's go ahead and get started. Now, just to go over some logistics, so if you have any questions, feel free to use the questions panel on the right-hand side of the GoToWebinar desktop. We have an abbreviated session today, but if we have time at the end and questions, we'll be happy to address those. Any questions that we don't answer, we will follow up after the fact. All right, so I want to tell you a little bit about who we are. CAQH is a nonprofit alliance of health plans and health plan trade associations working collaboratively to create shared solutions to reduce the administrative burden in healthcare business processes. So our board membership consists of the organizations you see listed here. There are chief collaborators helping us identify pain points between plans and providers and really solution a lot of the new capabilities that we're bringing to market. In addition to our member plans, CAQH has a broad reach and deep market penetration with nearly 1,000 participating health plans, hospitals, credentialing organizations. We have 1.6 million unique providers participating as well. I want to get us started with some poll questions. I want to learn a little bit more about those of you on the call. So I have a couple questions today to get some background. These will go by quickly. I've got maybe 3 or so I just wanted to ask. So I know that small is a relative term, right? So for the purposes of today's discussion, I'm going to define small as a plan having a network of 75,000 or fewer providers. And with that said, we're going to go ahead and launch the poll question. I want you to tell me the size of your provider network. Great. Looks like, yeah, a large number of those on the call have indicated that they have fewer than 50,000 providers in their network. So going to be happy today to go over some resources that we have available for you at CAQH for networks of that size. Our second question, have you considered outsourcing your provider data directory improvement process? All right, looks like some of you think that it might be worth taking a look outside. Some of you are looking at what you can do internally to address provider data quality. So that's great. And then our last question is annually, how often are you auditing the data accuracy of your provider directories? Now I'm really interested to see the outcomes of this one here. It looks like many of you are doing that quarterly. But we do have a couple that are doing it monthly, a bit more frequently, and then a few that have told us that they're still just doing it once a year. So, okay, great. Now, what we've found is that directory quality is something that should be monitored on a regular basis. So, providers are not staying at a given practice as long as they maybe have in the past. They're moving around. Data is always being updated. Phone numbers are being updated. So these are things that by auditing on a more frequent basis, you'd be able to kind of uncover what cadence of update is appropriate for your organization. So I want to dive into some of what we know here at CAQH around the provider data accuracy challenges. Focusing first on the provider side, so a provider or a practice, they're getting multiple similar inquiries from a lot of different health plans. So they're also having to share data in a variety of different data submission formats. So one plan may request an update through a fax. Another plan may request an update through a phone call or a web portal. So there's a lot of different ways that you can provide information to validate that directory data. And there's really a lack of standardization. So the way that a question could be asked, might have a variety of different answers. One thing that I see all the time is office hours. So one health plan may call and validate the office hours of a given provider, and another health plan may call and validate the office hours of the practice, which could be two very different things. Depending on how you answer that question, that could lead to a misunderstanding by the member of the data that's available in the directory. So, healthcare organizations, they're dealing with a number of challenges as well. There's providers that are simply unresponsive. They haven't engaged with the plan to validate the directory data in quite some time. The data is incomplete because of the difficulty in making these phone calls. You might have the wrong information for a provider, a phone number that hasn't been updated, or an email for somebody at the practice who hasn't been there in 6 months. So I want to talk about some of the varied approaches to the directory data request. I alluded to this already, where there's a lot of different mechanisms that a health plan may leverage to get a provider to communicate to them the correct data. So still many of the outreach requests are coming in through fax. There are some that are moving toward credentialing specific software, provider management and enrollment software. We see a lot of phone calls. Phone calls is what CMS has leveraged to do their outreach when they're doing audits. And so CMS was actually trying to simulate the experience of a patient who is trying to make an appointment at a given practice. So many health plans have adopted that. So phone is actually going up. Email is something that is low cost compared to some of the other solutions, but it's also something that doesn't have as high of a response rate. So just really want to highlight here, there's a lot that you can attempt, but you see at the end of the day, the data that's collected through these channels is still relatively poor. So let's talk about the American Medical Association. There was a survey done that really focused on member and physician impact. Now, what's really concerning on this slide here is the center number there, the 73%. So still, many physicians are simply unaware that there are regulations and mandates that provider directory data, needs to be improved. So of course, providers are going to we like to be optimistic, and the providers are going to make their best effort to get the correct data to any of the interested parties. But at the end of the day, that provider is primarily focused on making sure that their patients, your members, are receiving the best care that they can provide. So in reality, sometimes the quality of the data that's coming through is not as frequent as we would like, or maybe not as complete as we would like. Now, CAQH has actually done some extensive surveying of our provider community as well to really measure the burden on providers that I discussed earlier. So, when I was talking about how the providers or the practices may get multiple similar inquiries from health plans, in some cases they have maybe 20 or so contracts with plans per provider. That's a lot of different entities making phone calls to the practice to validate data on a regular recurring basis. So if the schedulers are tied up validating requests on the phone with health plans, that's one less scheduler that is available for a patient or your member, to make an appointment. So it really has an impact on the patient's ability to access care. And as you can see here, the practices themselves, being that they're just inundated with these requests, it's costing them nearly $1,000 a month just to maintain this data. The industry, could save nearly $3 billion if we were to find a kind of a different way of sharing, collecting, communicating this data. Now, on that survey, we discussed whether a single platform would benefit, the collection and distribution of this data. As we saw earlier, there was so many different ways that you can make outreaches to these providers to validate data. If there were a single platform, a single kind of unified solution that would be able to collect and share this information, we would be able to spend nearly 40% less than those that are using kind of multiple approaches, for a savings of about $4,700 per practice. So it can be very substantial. Now we're really focused on automation. If you've attended any of our previous webinars on directory data improvement or credentialing, one of the things that we're focused on here at CAQH is efficiency, and the way to get to that level of efficiency is through automation. So automating your key processes is going to deliver immediate benefits for your project and staff. So the providers, they're not going to have to worry about sharing data through these different channels. They'll have a simplified data collection process, reduced administrative burden and costs, a better experience with the health plans, which could lead to network improvement. If the providers are sharing, oh hey, it's so easy to work with Plan X, they could really help to move the needle when a plan is considering how to expand their network in a particular region. Similarly, on the health plan side, the data collection process has been simplified. Confidence that the data that is being collected is accurate. So if there's a single unified channel, you're not dealing with disparate ways of pulling the data. It's going to be of a higher quality, and then you're going to get that data in a timely fashion. So like I said, the different data elements within the directory data set are changing. They're very fluid. They're changing regularly. So you want to make sure that you're getting it on a repeatable, timely, scheduled manner. So we've alluded to how we have alleviated that provider burden, but I just wanted to share a couple more details on how we're doing that through our application. So we're looking at the ProView login screen here. ProView is an application that the providers have been using for quite some time, historically focused on credentialing. The directory data is actually being leveraged here as well. We've got 1.6 million providers that already know, they already trust the solution. Every time I go to my doctor, if it's somebody new, I ask them if they're familiar with CAQH, and 9 times out of 10 they are. So the application has over 225 self-reported and attested data elements. So a very broad data set that a health plan would be able to leverage. And these providers are coming in on a regular basis. So they are reattesting or certifying that that data in their profile is accurate every 120 days, many of them coming in more frequently than that to guarantee that the information is up to date. Now, in addition to just coming in on a regular basis and adding all of this highly accurate information, the ProView application asks questions in a kind of in a nuanced way to elicit the best responses from providers. So we're not just saying, hey, do you practice here? We're getting the how they practice here, the affiliations for a given location. So the frequency of practice. So perhaps a provider, they have a practice location, but maybe they only see patients there 1 day per month, or maybe they only read tests or cover for colleagues at a given location. Those are, that's metadata that the health plan could leverage to make business rules and decisions on how they should list those locations in their directories. Additionally, we present locations that have been submitted by the health plans for a provider to accept or reject, or really to reconcile. So if a provider says, no, I don't practice there, then we can reject that from the profile, share that information back to the health plan, and the health plan can remove it from their directory, immediately increasing the quality of that directory, in the event of audits or member complaints. Additionally, we're collecting confirmations from providers on phone numbers. So if we think about the CMS audits that have been done, many of us are familiar with that. They've been doing it year over year for the past 3 or so years, where they found about half of the directories out there contain some sort of error. The primary error was that the provider is not actually at the location, but the second highest error that is in that critical list is that the phone number is wrong. So we actually present this to the provider before they are able to attest after they've added a location, requiring them to confirm that the phone number is good and that it is one that can be used by patients to schedule an appointment. And that the first error that's reported by CMS, the one where the provider is not actually at the location, yeah, we're solving for that one too. So within ProView, if a provider has a location that we feel should not be in their profile as a result of our machine learning capability, then we can actually present that to the provider in the workflow and allow them to remove that data from the profile before it ever gets to the plan. So this way, the provider's cleansing their own data, and the health plan doesn't have to spend any additional cycles validating the data or doing additional outreach. If they know it's bad upstream, they can simply suppress it from their directory. And after all this kind of internal cleanup, the provider is prompted to review their directory data and then attest to the data. Remember, they're coming in and doing this every 120 days. In some cases, they're coming in more frequently than that. But we are always sure to give them an opportunity to review that directory data that's going to be shared with the health plan. So that's really how we focused on the provider and allowing them to enter all of their data in through a single channel that can be consumed by health plans. Now, focusing specifically on those healthcare organizations with smaller provider networks, I wanted to look at some of the common problems that have been voiced to me and some of my colleagues. Really, a smaller health plan is going to make sure that that they have the ability to benchmark. So sufficient budget being available to tackle these big industry problems like provider directory data quality. We need to make sure that we're focused on the return on opportunity, return on investment. If we can help the plan benchmark what those goals or requirements where you're at currently, then you can set realistic goals that can be shared with leadership. So that's one of the bigger problems that's been suggested. Also, the technology. So some smaller health plans, even larger health plans really, may not have access to technical resources to implement more technical solutions like APIs or advanced SFTP reporting, things like that. Also, the need to have a continuous technical team focused on this. We really are updating the product on a regular basis, and you need to have resources available to kind of jump in and make sure that you have the latest technology to tackle the issues. So that's something that we see on a regular basis. And then provider adoption. That one is really addressed already with our ProView application. All right, now the way that we tackle those problems that have been brought up is with our solution CAQH DirectAssure. So DirectAssure is layered on top of ProView. Those screenshots that I was showing you earlier from the provider's perspective. A provider, they have been using ProView for years and they'll continue using ProView for years. The DirectAssure product is something that we market toward our health plans and other interested organizations, and it really just layers an additional layer of quality checks into the existing ProView application. So we're focused on reducing the administrative costs, associated with dealing with high volumes of data, taking on the outreach on behalf of a health plan, and then really reducing that provider friction. And we do that by allowing a health plan to submit to us a list of all of the locations they know to be associated with a provider. We then allow that provider in the ProView application, as you saw earlier, to reconcile those locations. We set up those providers on the health plan's what we call roster to essentially get quarterly outreach from us in the form of phone calls and emails, regular updates, and then we take all of that cleansed data that we're collecting from these providers and sending that back to the health plan, allowing them to take action on their directories. And we've had a lot of luck so far. So as you can see here, we've got a couple, case studies, couple examples where some national plans have actually experienced very high level of improvement in their accuracy. So one thing that I always like to see is that there was a participating plan that mentioned that each location that's rejected by a provider is one less phone call. So that's very compelling. Most of our providers, 90% or so, are actually logging in and attesting to their data just after one email, and they don't necessarily need an additional phone call. One health plan that we worked with reported a data quality of over 84%. So a dramatic improvement in in quality when we consider that the industry, as audited by CMS, was at kind of a baseline of around 49-50%. That's a dramatic improvement. The ability to reject these locations by health plans. Or by providers that have been submitted by health plans, really results in a minimum improvement of 20%, right off the bat. Now, if you're a health plan with a smaller network, perhaps you don't have the resources to implement an API, you don't have those technical resources available. We actually have a DirectAssure portal that allows you to manage, even a business user, to manage the majority of the DirectAssure capabilities without having to engage that additional staff. So we have outreach that's available here. You can access which providers have been rostered. You can check the status of rosters that have been submitted. There's graphs that can be downloaded and get a confirmation of the number of providers that are on your roster currently. Now, CAQH is running the outreach for health plans as well. So as I mentioned earlier, we're sending emails on a quarterly basis. We're making phone calls regularly. So as we are collecting the outcomes of those phone calls and emails, we're actually collecting those into these outreach compliance reports, which are made available to you on our portal. So there's no need to have technical resources engaged if you need to set up an SFTP connection. Any business user can log in and download those reports. And one thing that's very important to the health plan that is leveraging the DirectAssure product is you need to see which of your locations that you've submitted have been reconciled by the provider. So if a provider is coming in and saying, I don't actually practice at the location that you think I'm at, you need to be able to download that information quickly. So we have these location reconciliation reports. These rejection reasons, give you a lot of context. So it goes beyond a provider just saying, hey, I don't practice here, I'm rejecting this. They can actually tell you that they're no longer a part of this particular group, or that the address is incorrect, or that it's maybe a duplicate. Also, it's really important to note that rejection, so if a provider rejects a location that was submitted by one health plan, and another health plan were to try to submit the same location for the same provider, just thinking of the overlap, then the second plan will actually be able to take advantage of that rejected data that the provider has already indicated, from the first plan. If they say, hey, I don't practice here, it doesn't matter, which plan is submitting that, the response is going to be consistent. So right off the bat, you're able to take advantage of all of the rejections that had been previously indicated by a provider. And I know that was a lot of content, but just to summarize, the technology requirement for smaller health plans, if we were to leverage these capabilities in our DirectAssure portal, we've really reduced or eliminated the technology lift that's necessary. These performance insights are available 24/7. You can download reports and have the access to these dashboards. Continuous education, training, different services. We want to partner with you, so there's a lot of great help documentation available, and our implementation specialists are here to make sure that you go successfully through the whole process. We've got 1.2 million providers reattesting on a 120-day cycle, so the data is always fresh, always going to be up to date. And then we really align our questions with the CMS audit process, the different CMS requirements that are coming down, and we have a team of strategists internally that are looking at upcoming federal and state regulations. And then really the completed files and coordinating reports are available through that dashboard. Again, we want to make it as easy for you to take advantage of the product without a lengthy technical implementation. All right, so hope you can see that the really DirectAssure is a solution that is available to plans with networks of varying sizes. We're really excited for the opportunity to partner with you to improve your provider data quality and reduce provider burden, and really ensure that your members have access to the care they need on their terms. So please feel free to reach out to me or any of the CAQH team members if you're interested in learning more. And it was great spending some time with you today.